I'm Anthony Nguyen. Join us as we change the narrative around aged care, one story at a time. Right, welcome back to the Pioneers in Aged Care podcast. Here we have Tammy Ridgway, the General Manager of Client Services at Mercy Health. Welcome, Tammy.
Thank you, Anthony. Thank you for having me.
No, thank you so much for agreeing to be on. I've been stalking you and spamming you and texting you and finally hunted you down.
Yeah.
And before we get into the episode, I wanted to say thanks to our sponsors. So 2 sponsors for this episode. One is Aurelia Legal, which is an immigration law firm focusing on the aged care sector, specializing in navigating 482 and 186 visa sponsorships. And also zipline.io, which exists to serve aged care's needs through frontline compliance, visitor management, and enhanced resident experiences. So thank you so much to our sponsors. Without them, it would be difficult to have this conversation.
Excellent. I know Zipline very well. Have used them in the past.
Oh, fantastic.
Yeah, great.
Alrighty. Okay, let's start with getting a broad overview as to Mercy Health. I want to learn about them as an organization. Can you tell me who they are?
Yes, sure. Mercy Health's a faith-based, not-for-profit organization. Started in 1831 back in Dublin by Catherine McAuley. So she's our founding sister, who then created the Order of Sisters of Mercy. And they came to Australia back in 1846, I believe, and started to establish hospitals and then continue their mission to meet the unmet need in the community. So today we are a workforce over 10,000. We have subacute and acute hospitals, as well as residential aged care, retirement living, home care, and then many community services like dementia advisory service, palliative services that we provide to the community members. And then we also are pioneers in women's specialty health, I should say, particularly in complications in pregnancy, preeclampsia, for instance. And we're world renowned for our research in those fields as well. So we stretch far and wide. We have prenatal services, early learning centers. So I guess it's the full
life cycle.
Full life cycle, yes.
Wow,
Yeah.
Fantastic. And on the aged care side, how many nursing homes do you cover?
We have 30 at the moment and pretty ambitious to grow. We've got 3 development pipelines as we speak in the works.
Wow.
We've got 10 retirement villages and then, yes, a big footprint in home care as well.
And tell me about your role at Mercy Health.
Yeah, so my role, I'm fairly new to the organization. It's been almost a year at Mercy Health after a long stint with another provider. And I currently am the general manager of client services. So I was brought on board really to consolidate healthy aging is what we're called. That's our branch. And making sure that our customers, regardless of the service that they need, that they have a single point of entry. And so breaking down those silos that have traditionally been held, retirement village, home care, or residential aged care. So making it really easy for a customer to come directly to us and access any of those channels throughout their life cycle.
Can you, and this is why I love my job, because it allows me to really learn what everyone does. There's so many different angles within aged care. So when you said allowing clients and residents to access your services through one channel, what did it look like before? And for me to understand what someone does, I need to understand the problem, what it was before.
Yeah, so absolutely. If a customer needed to access our services, they probably traditionally would go onto the website, they contact a 1-300 number, and they would be vetted out really quickly. Oh, I'm sorry, you're calling for a retirement village. You need to speak to Sally over here. And then sometimes they would get lost because wherever they were coming through, that person might not really know, oh gosh, I don't have that phone number. I really have no idea who does retirement village because I do residential aged care. So we've introduced the 1-300 number and been trained the teams basically for every business stream. This is high level. This is what they do. You should be able to ask the customer some qualifying questions, really that active listening, because sometimes they're calling out of desperation. They don't even know what they need. They don't know if they've got funding, how to access funding. So having that one point of call into a customer engagement team that can help them calm them, hand them over, a warm transfer to the right person to support them. And then that follow-up call afterwards, a couple of days later, how are you going? Did you get access to what you needed? Do you need any further information? So previously it was quite disjointed, and now proud to say after a short time, 1 year, we have established a customer inquiry center. We've established a CRM system. So any customer coming into us, we can vet them out, even if they end up, and we had a really hilarious lady call from South Africa saying, one of my children was born at one of the Mercy hospitals and I need their birth certificate. And we were able to help facilitate that instead of sending her on a wild goose chase, like call the hospital, I don't know, here's their phone number.
Wow, gee, that's fantastic.
Yeah.
And tell me about your journey into aged care.
Oh, wow. So my journey into aged care started back in 2008. After a long period of time as a professional, stopped to be a stay-at-home mother, and then it was time to rejoin the workforce. And I thought, gosh, what do I want to do? I spent so much time. I was the group leader of the Scout Hall. I was on the FATE committees for the children's schools, and I thought I really want to give back. I really enjoyed that. So a role came up as an executive assistant to the general manager of sales and marketing for a large aged care provider, and I thought, aged care, let's go see what this is all about. And I was lucky that I was successful in that role, and I've never looked back. I've enjoyed every minute of it.
And I can see why, if you had those type of roles, being a stay-at-home mom is hardest job.
Yep.
It's a million things to keep track of, and you can't turn that off. You're always on.
Yeah.
And then to volunteer your services to coordinate those facilities, those responsibilities as well, and activities with children.
Yeah.
Very hard.
Yeah.
And what was it, a big shock coming into aged care?
No, it wasn't. So at the time, it was implementing a system into home care with the case managers, and that's my wheelhouse. I'm a change agent. I love process. I love making sure that processes are interrogated, that the disciplinary teams within the business understand how that new system is going to impact them, because if they don't get it, it impacts the customer. So I was able to quickly get into my wheelhouse, which is change and process development and systems implementation. So I've just, never looked back. There was nothing, I think, shocking to me in aged care. What I loved is everybody in aged care is here for the same purpose, and that's to make a difference. I've never met anybody in aged care that was here for the wrong reasons.
Yeah. And when you joined Mercy Health, what made you choose them as an organization? Because I think I remember going through your LinkedIn profile, and you had you climbed the career ladder.
Yep.
So you would have had your pick of the bunch.
Oh, thank you. Mercy, what appealed me to Mercy was their values, and they are, again, being a faith-based organization, and I come from Texas, a very faith-based state, and it spoke to, I guess, to my core values, and that was important to me, to align myself with an organization that's aligned to my values. I think probably everybody's that way, but in particular, Mercy, their ambition to grow and to ensure that their back of house is ready for that growth, and making sure that they continue to stay true to their mission, which is finding that unmet need in the community and making sure we're meeting that need. So for instance, making sure people that might not have the discretionary income to access, let's say, additional services in residential aged care, how do we as a not-for-profit funnel some of our revenue to make sure they have equitable access to the services that we provide?
And what's on for the next 12 months?
Oh, the next 12 months, I think, like all providers, we will be embedding the new Aged Care Act, the strengthening standards, making sure that we're compliant to that, and make sure that our systems, and again, back of house, are robust, that our systems have been modified to implement those changes effectively.
And now that you've been at Mercy Health for almost, has it been 1 year?
Yeah, it'll be, I think it is.
And aged care altogether, how long do you think?
Since 2008, what is that, 14 years, 12 years? I don't know, I'm not good at math,
So what's exciting you about the aged care industry going forward?
Again, I think it's back to the new Aged Care Act and the standards, the strengthening standards, and making sure that we're adapting our services to implement the changes and make sure that we're meeting the customers and our very diverse customers coming through the aged care pipeline now. I think it's something like we're going to triple the aged care in the places that we need an aged care in the next, by 2045, I think it is. So with those challenges comes great opportunity. So it will bring new organizations, it will bring new services, and I'm really looking forward to taking that next step. We've been talking about innovation for a long time in aged care, and we all laugh. Innovation, what is that? A new system. We need this innovation. We need the youth of today to embrace AI and to come into the aged care sector and turn it on its head and think about new ways that we can support those that are aging in a different world, as it is shaping up to be very quickly.
And is there anything in your job that, any innovation, technology, anything that has made you gone, this is going to help me in my role?
Oh, AI. AI is completely, every day it is changing and it's adapting. And although it's scary, it's also exciting. And for me, it's working really closely with our IT teams and reviewing our whole IT stack and thinking about how do we automate this? How do we give our customers access to information or the ability to opt into services on the spot, opt out on the spot, and remove that administration burden of our site teams who usually primarily spend a lot of time in that admin space to make sure that what they're doing there at the home is fed back somewhere centrally so you can do reporting, to cut that down, because the more time our site teams are spending in that administration space, it's removing them for their ability to access and deliver services to our residents or our clients.
Yeah. Now, correct me if I'm wrong. So if I understand your role correctly, it's essentially making the transition from wherever the residents and clients are smooth into aged care. What's out there at the moment where that I phrased this in my head so well, but now I'm just stumbling to get it out. What do you see out there at the moment that is going to make a potential resident go, I really want to join Mercy Health?
Oh, I think it's going to be the service offering for sure. I think clinical care is a ticket to play. We all provide and provision really excellent clinical care across the sector. It's going to be the innovation. It's going to be, how do you help me continue to live a fulfilled life even though my health is declining and I might not be able to access the community? How are you going to bring the community to me? And I think there's a lot to be done in that space. And my role is not only looking at customer acquisition and retention, but it's also looking at that during the cycle of their stay, making sure, again, they have access to our hospitals, they have access to our home care, as well as us as a provider, making sure that all of their needs are met to the individual. And I think the standards show that. It's very customer-centric. We've been talking about person-centered care for a long time, and I think a lot of providers have really struggled to make sense of that. And how do you, in a operationally challenged environment where we have workforce challenges, we have agency staff that might not know today that resident, how do they know that Tammy wants a glass of wine with her meal or Tammy wants these bespoke services? We really need to think about how we can do that.
You know what I like about your answer is your answer is basically being the best of the basics, because clinical care is the foundation of aged care.
Yes.
And I was sort of expecting, food, AI, robots, and these are all fantastic things that the new wave of aged care residents, the baby boomers, are going to be expecting.
Yeah.
But at the core of it is that clinical care.
Yep. Correct. And I also think you just nailed something there. You said the simplicity or the basic foundations. And, I had a family that stuck for me for a really long time. They were, the constant complainers, the high touch family. The facility manager couldn't navigate them to come to, an agreement. They were constantly complaining. And then it would get escalated to the regional manager. And then it finally came to me and I thought, oh goodness, here we go. And the family were so articulate. And I kept that active listening. They're like, surely this seems so simple. Like I must be missing something. They're just gonna end up complaining again. They wanted their dad's room cleaned. And so I went into the room and spent some time with the dad and realized that the top of the wardrobe wasn't as clean as it the drawer was broken. It was something so simple.
Mm.
And then when I really started to interrogate with the team, like, why aren't we addressing that? And it's like, well, we've got a microfiber solution system here. And we, OH&S, we can't really get the staff up on a ladder to go into the wardrobe. And it was like, we were totally crippled by our own systems. And if you change the microfiber solution system now that's in an iPad, we're going to have to get the vendor involved. And then it's going to impact productivity with our cleaners. And it was like, stop.
Wow.
We can do this, because if his wardrobe's dirty up here, that means all the other 90 residents' wardrobes are dirty. If we can fix this and find a solution, then we've got 90 happy customers. So I think it is sometimes get back to the basics.
Yeah.
Don't boil the ocean. Don't just start going out there and throwing technology out of something that our clients haven't even asked for. So making sure we stick really close to our clients and what they are wanting.
I love that story.
Oh, thank you. Yeah.
All right, let's get into the questions from the sponsors. So the first question is from Nilesh Bansal, the principal and founder of Aurelia Legal, which is an immigration law firm focusing on the aged care sector, specializing in navigating 482 and 186 visa sponsorships. His question is,
hello, my name is Nilesh Bansal, founder and principal of Aurelia Legal. We specialize in helping aged care providers plan workforce strategies and assist them with visa applications for their staff. My question is, looking ahead, what do you see are the biggest hurdles in maintaining adequate staffing levels? And are there any particular roles or skills that are proving especially difficult to fill in Australia? If so, how do you intend to address these challenges? Thank you.
Well, probably the most boring topic in the healthcare sector is workforce challenges. It's not going to go away. Specifically, the roles that are challenging to recruit for are the registered nurses, the enrolled nurses. They count for 44 minutes per day per resident. So we're all pulling for it from a very short or a very reduced pool, being here in Australia and so removed. So we have to rely on international talent. We all have to get into the labor agreements, and those in themselves are complex to navigate. You've got to nuance each of those visas in a certain way. Everybody has unique sets of situations. For Mercy, we are looking at organizations such as PALM. I'm not sure if you've heard of PALM.
yes.
Yeah, so that for us, again, is aligned really closely to our mission of helping those in need. So for us, it is a dual benefit, whereas we're able to pull talent from our Pacific Islander neighbors, and PALM will bring them in. They'll do a 4-year stint. It's skilled and unskilled staff. And they set up our own community. So they look after their well-being when they're here. It's really important that they have a network to pull from. And then we can benefit in our regional homes, particularly where we've got this commitment for 4 years with you've got a cluster in their own community and they're supporting each other. And that something like 50% of their wages go back to their homes to then support their families. So we're looking at partnering with organizations like that. And recently I just had a recruiter that I spoke to last week, which I thought was sensational. And he's starting to look outside of the box as well. And he said, the aviation industry, they've already solved this issue where they've got, it costs them time and money if they've got a plane sitting on a tarmac and they've got to take off and cabin crew are not there. So you've got angry customers, they'll get penalties. So they have rostering, they've outsourced rostering to overseas teams that are connected into their rostering systems, and they look at their whole pool of talent. And so instead of going to agencies, they are immediately calling their staff. That is really difficult in our, here we've got this opportunity. We've got 10,000 staff in the healthcare sector that we should be pulling from. So starting to think about, okay, what does that rostering look like outsourced somewhere, but it's our own talent where they're pulling from maybe the hospital. Somebody's going into a portal and going, hey, I do work at Werribee Hospital, but I've got these shifts available. I would be happy to be working in your residential aged care homes or pick up some home care shifts to go in just to get that diversity as well for them to go, I don't have to just keep going into the hospital every day. I can actually go into the home of another client for our home care team. So we're looking and exploring those options as well.
initially I was thinking that's a crazy idea,
Yeah.
but as you kept going, I thought it is such a simple idea.
Yep.
It's using your own staff. How crazy is that?
Yeah, how crazy is that? And you would think that more times than not, providers, we do struggle with that. But we will, at Mercy Health, we are going to start looking at ways to pull our staff more effectively.
Fantastic. The next question is from Michael Momsen, the CEO and founder of Zipline.io, which exists to serve aged care's needs through frontline compliance, visitor management, and enhanced resident experiences. So his question is,
we understand that there's complexities to ensure all the credentialing, worker rights, compliance checks are all in place across the entire workforce and the subcontractors, especially now in line with the new Aged Care Act coming out. What are some areas that you think could be improved while executing on that experience?
So I've used Zipline before, and it is an excellent platform, I must say. And it is something that we are going to be exploring at Mercy Health, to be honest with you, because we do have a challenge, and it's more for the subcontractors. For our staff, we've got pretty robust systems to monitor compliance. It's tied in with our rostering system. Agency staff, that's something we need to be doing better, making sure that they are rostered in and they're counted towards the care minutes. And the subcontractors is a challenge, making sure that when they come on site, although you might have a procurement team that are making sure they've got their certificate of insurances and their police checks are in order, that doesn't necessarily cascade down to the site teams. So we will be looking at introducing a system, because that is, again, through the strengthening standards, trying to make sure that, again, providers have more robust compliance measures in place to make sure that those that are entering, more specifically our residential aged care, that they've got the appropriate qualifications and the police checks if they're going to be unaccompanied with our residents. So we will be looking at systems like Zipline, matter of fact.
Fantastic. He'd be so happy that you answered in that way.
Oh, good.
Now, tell me about yourself. Outside of aged care, outside of work, what are you interested in?
What am I interested in? Well, a couple of years ago, like probably most people during COVID, went, I need to move out. I'm sick of living inner city. I need a bit of fresh air. So moved out a bit and ended up with this property in a really big garden. And I do not know how to garden. So I spend a lot of time pretending I know how to garden. And I'm so bad at it. It's 2 years later and I barely have any plants because I also have rabbits.
All right.
So my property is not rabbit proofed. And I continue to buy these beautiful plants that say that they're rabbit proof, but matter of fact, rabbits will eat anything, I've come to find out.
Oh, you bought the rabbits or they're wild rabbits?
They're wild rabbits
okay.
that come into the backyard.
Yeah.
So I spend time trying to garden, but I also spend time with family. I've got 2 children that are young adults now, so we spend a great deal of time together on the weekends and with friends and wineries. I live on the cusp of the Yarra Valley, so very blessed to be near wineries. So spend a lot of times on the weekends just reconnecting with friends, family, and wine.
And you said you're from Texas?
I am from Texas, yes, originally from Dallas.
Why would you move?
Yep. So,
hold on. I just stumbled.
Why would you come here?
Yeah. Let me ask that again, just for the camera's sake. Why would you come to Australia from Texas?
Yeah.
Texas is pretty cool.
Texas is a pretty cool place. So originally my husband at the time was transferred here with his job, and we lived here for 3 years, had our first child, moved to Singapore for a while, did a stint in Hong Kong, and then ended up back in Texas and went, I love Australia. So came back to Australia. Okay. And never looked back since. My whole entire family are still in Dallas, so it's just myself and the children, and my second husband now. I did marry an Australian, so
there you go.
Yes, I say all the time I've upgraded to an Australian. Don't tell my ex-husband that. No, he's a great guy. He lives here as well. He could never leave. It's Melbourne specifically is an amazing place.
And what's a final message you would like to give to anyone out there considering a career in aged care?
Oh, give it a go. It's going to be nothing that you expected. I think there is a lot of still taboo. Oh, aged care. Oh, my grandparents were in aged care. You walk into these environments now, our residential aged care homes, they are vibrant. We at Mercy Health, we have grocery stores. We're committed to the small household living model. So we've actually got these self-contained units within the home where they do their own cleaning. They do their own laundry, they have the ability to cook if they want to. So really promoting that independence. We have on-site cafes. So long gone are the days where you go in and everybody's just banked up watching TV. So I would say to anybody, especially our younger generation, we need them. We need their abilities just to pick up systems and look at a system. I've got some young talent in my team that are like, why are we doing this? Did you know we can just do this? I'm like, no, I did not know that. Yes, let's do it. So yeah, I would say, give it a go. You'll never look back.
And I love that message because yes, there's still that stigma and still that imagery of aged care being a place where people are banked up watching TV.
Yes.
It's not that anymore.
No, it is not that anymore.
Tammy, thank you so much for being on the podcast.
Thank you. Thanks, Anthony.
Cheers, guys.
Bye.